Your doctor handed you that prescription and said, take 1 tablet daily. And you have been doing exactly that faithfully every morning with your coffee, like millions of Americans over 60. Here's what many patients are never told. The time you take your blood pressure medication and what you take it with can either help protect your heart or leave it vulnerable during the hours when it needs protection most. Not by a small margin, not by a difference that only matters in a laboratory. We are talking about differences that may influence how effectively your treatment works during the most critical hours of the day. There are 5 timing mistakes that people taking blood pressure medication make every single day, often without realizing it. Some of them seem harmless. Some are hidden inside routines you have followed for years. And one of them may be happening in your home tomorrow morning unless you know what to look for. Many people believe managing blood pressure is simple. You take the pill, attend your appointments, refill your prescription, and trust that everything is under control. But the human body is not a machine that operates the same way every hour of every day. Your blood vessels change throughout the day. Your hormones change. Your heart changes. Even the way your body absorbs medication changes depending on when you take it and what is happening inside your system at that moment. That means timing matters more than most people realize, especially after the age of 60, when the cardiovascular system becomes less forgiving and small mistakes can have larger consequences. Let me ask you something. Have you ever stood up quickly and felt dizzy for a moment? Have you ever wondered why your blood pressure seems normal at the doctor's office, but spikes unexpectedly at home? Have you ever woken up in the middle of the night needing the bathroom, only to feel unsteady on your feet? Have you ever forgotten a dose and wondered whether taking 2 later would make up for it? If any of those questions sound familiar, then today's conversation is for you. Because these experiences are far more common than most people realize, and understanding the reasons behind them can help you make safer, smarter decisions about your health. My name is Dr. Natalia Wright, and welcome to Dr. Natalia Wright Senior Health. This channel exists because adults over 60 deserve clear, practical, evidence-based information about their health. Too often, important details are compressed into a brief office visit. Questions go unasked. Concerns remain unexplored. The goal here is to bridge that gap and help you understand not only what to do, but why it matters. Think back to when you were younger. Your body recovered quickly from missed sleep, skipped meals, and occasional health mistakes. A late night might leave you tired, but by the next day, you bounced back. As the years pass, however, the margin for error becomes smaller. Your arteries naturally become less elastic. Your kidneys process fluids differently. Your balance may not be as reliable as it once was. None of this means aging is a problem. It simply means that details matter more than they used to, and medication timing is one of those details. One of the biggest misconceptions about blood pressure treatment is the belief that medication works like a light switch. Take the pill and protection instantly turns on. Skip the pill and protection turns off. In reality, the process is much more complex. Your medication enters the stomach, passes through the digestive system, enters the bloodstream, travels throughout the body, and interacts with receptors inside your blood vessels, heart, kidneys, and nervous system. Every step in that process is influenced by timing, food, hydration, and daily habits. Imagine a homeowner preparing for a storm. If they put plywood over the windows after the strongest winds have already passed, the protection arrives too late. The timing matters just as much as the protection itself. The same principle applies to blood pressure management. Your body experiences predictable periods of vulnerability, and your medication needs to be working effectively during those periods. One of the most important concepts for older adults to understand is something called the circadian rhythm. You may have heard the term before. It is essentially your body's internal clock. This clock regulates sleep, hormone production, body temperature, digestion, and blood pressure. Every 24 hours, your body follows patterns that have been programmed into human biology over millions of years. During healthy sleep, blood pressure typically drops. Physicians sometimes call this dipping. It is one of the body's ways of giving the cardiovascular system a chance to rest and recover. Then, in the early morning hours, something remarkable happens. Hormones begin preparing you for the day ahead. Cortisol rises. The nervous system becomes more active. The heart works harder. Blood pressure begins increasing. For many people, this morning increase is normal and manageable. But after 60, it can become more significant. Arteries lose some of their flexibility. Plaque accumulation may narrow blood vessels. The heart may have to work harder to push blood throughout the body. As a result, the early morning hours often become the period when cardiovascular events are most likely to occur. Think about that for a moment. Most people worry about their health while they are awake and active. Yet some of the most important cardiovascular changes happen before breakfast, before the morning news, before the first cup of coffee. They happen while many people are still asleep. That understanding brings us to one of the most overlooked mistakes involving blood pressure medication. The mistake is not necessarily forgetting a pill. It is not taking the wrong dose. It is assuming that the timing written on the label is automatically the best timing for every individual. While medication schedules should always be discussed with your healthcare provider, understanding your body's natural rhythm can help you ask better questions and become a more informed participant in your own care. Before we go further, I want you to think about your own routine. What time do you take your blood pressure medication? Is it first thing in the morning? With breakfast? Before bed? Have you been following the same schedule for years simply because that is how it was prescribed originally? Many people have never revisited that conversation after starting treatment. Yet your body at 75 is not the same body you had at 65. Health conditions change. Medications change, lifestyle patterns change. One retired engineer once told me he had taken his medication every morning for nearly 15 years without missing a dose. He was proud of his consistency, and rightfully so. Yet when he underwent more detailed blood pressure monitoring, the readings revealed significant spikes during the early morning hours. His numbers looked fine during daytime office visits, but the period when his cardiovascular system needed protection most was not being adequately covered. The issue was not his dedication. The issue was that no one had examined whether his timing still matched his physiology. Stories like that are surprisingly common. Many adults assume that if their office readings are acceptable, everything must be perfect. But blood pressure is dynamic. It changes minute by minute, hour by hour. A single reading provides only a snapshot. Understanding patterns often tells a much richer story. Now let's talk about another habit that millions of adults over 60 consider non-negotiable: morning coffee. For some people, the day simply does not begin until that first cup is in hand. The aroma, the warmth, the comfort of a familiar routine. There is nothing inherently wrong with enjoying coffee. In fact, moderate coffee consumption may fit comfortably within a healthy lifestyle for many individuals. The problem arises when coffee interacts with certain medications in ways that people do not expect. If you are taking a beta blocker, the timing of that morning coffee may matter more than you realize. Beta blockers are commonly prescribed to slow the heart rate, reduce blood pressure, and decrease the workload placed on the heart. They are often used for hypertension, heart rhythm disorders, and other cardiovascular conditions. Caffeine works differently. It stimulates the nervous system. It can temporarily increase heart rate and blood pressure. Imagine trying to slow a car while simultaneously pressing on the accelerator. Both forces are acting at the same time. In many people, the medication still performs its job effectively, but in others, particularly those sensitive to caffeine, the interaction may create symptoms such as palpitations, nervousness, or a sensation that the heart is beating irregularly. One woman in her late 60s described feeling a fluttering sensation in her chest nearly every morning. She worried constantly that something was seriously wrong. She began avoiding walks because she feared triggering a heart problem. Yet, after carefully reviewing her routine, a pattern emerged. Her coffee and medication were being taken almost simultaneously every day. A simple adjustment in timing dramatically reduced her symptoms and restored her confidence. What is fascinating about stories like these is that the solution often appears obvious in hindsight, yet nobody had connected the dots. Nobody had asked about coffee timing. Nobody had examined the routine itself. This highlights an important lesson. Health management is rarely about one dramatic decision. More often, it is about small adjustments repeated consistently. Tiny changes can create meaningful improvements when practiced day after day, month after month, year after year. Another habit worth discussing is hydration. Many older adults intentionally drink less water because they worry about frequent trips to the bathroom. While understandable, inadequate hydration can sometimes contribute to fluctuations in blood pressure, dizziness, and inconsistent medication absorption. Taking medication with an adequate amount of water may help create more predictable absorption patterns and support overall cardiovascular function. As we continue this conversation, you may begin recognizing parts of your own routine. Perhaps you are remembering a symptom you dismissed months ago. Perhaps you are thinking about a medication schedule you have never questioned. Perhaps you are realizing that some of your daily habits deserve a second look. That awareness is valuable, because the first step toward better health is not fear, it is understanding. And understanding becomes even more important when we discuss a common breakfast item that can quietly interfere with certain blood pressure medications for days after consumption. Most people know there are some medication interactions involving grapefruit. What many do not realize is how long those interactions can persist and how significant their effects may be for certain individuals. The story behind that interaction reveals just how surprisingly powerful food can be when it meets modern medicine. Most people assume that if a food interacts with a medication, the effect lasts only a few hours. Eat the food, take the medicine, and by the next day, everything returns to normal. Grapefruit does not always follow those rules. For certain blood pressure medications, its effects can linger far longer than most people expect. That is why so many adults unknowingly put themselves at risk despite believing they are being careful. Imagine your digestive system as a sophisticated transportation network. Every medication you swallow must travel through a series of checkpoints before reaching the bloodstream. These checkpoints help regulate how much of a drug enters circulation and how quickly it gets there. One of those checkpoints is a group of enzymes responsible for breaking down specific medications. Grapefruit contains naturally occurring compounds that can interfere with this process, essentially disabling part of the body's normal medication processing system for an extended period of time. What makes this particularly important for older adults is that age already changes how the body handles medications. Liver function may slow slightly, kidney function may not be as efficient as it once was. The body composition itself changes. Add a food-drug interaction on top of those natural age-related changes, and the results can sometimes be significant. Picture a dam controlling the flow of water into a river. Under normal conditions, the gates open and close in a controlled manner. Now imagine those gates suddenly becoming stuck open. More water rushes through than intended. That is similar to what can happen when certain medications encounter grapefruit-related enzyme inhibition. Higher amounts of the medication may enter the bloodstream than originally expected. For some individuals, this may lead to dizziness. Others may notice unusual fatigue. Some experience lightheadedness when standing. In more serious situations, blood pressure may drop too low, increasing the risk of falls and injury. A retired electrician once described a frightening experience that began with what seemed like a healthy dietary change. His family started purchasing a citrus juice blend marketed as heart-friendly. The label looked harmless. It contained several fruits, including grapefruit. He never thought twice about it. Within days, he began feeling unusually weak and dizzy whenever he stood up. One morning, he lost his balance and collapsed near the kitchen table. Fortunately, he was not seriously injured. But the incident illustrates an important point. Health decisions do not occur in isolation. A medication does not know whether it is entering a body that recently consumed grapefruit. It simply responds to the environment it encounters. When that environment changes, medication effects can change as well. This is why reading labels matters. Grapefruit is not always obvious. It may appear in juice blends, fruit beverages, nutritional products, or specialty drinks. Sometimes people consume it without realizing it. The goal is not to create anxiety around food. The goal is awareness. Knowing which foods interact with your medications allows you to make informed choices rather than accidental ones. As you think about your own routine, ask yourself this question. If someone handed you a glass of juice tomorrow morning, would you know every ingredient inside it? Most people would not. Yet those details can matter more than we realize. This brings us to another timing mistake that affects countless adults over 70, and unlike grapefruit interactions, this one often disguises itself as a normal part of aging. People assume it is simply something older adults must live with. They accept it. They adapt to it. They rarely question it. The problem begins with a trip to the bathroom. At first glance, that statement sounds almost trivial. After all, frequent nighttime urination is common among older adults. Many people assume it is an unavoidable consequence of aging. They arrange their lives around it. They keep a nightlight on. They learn where every piece of furniture sits in the dark. They joke about it with friends. But behind those nighttime bathroom trips may be a medication timing issue that deserves attention. Diuretics, often called water pills, play an important role in blood pressure treatment. They help the body remove excess fluid, reducing the workload placed on the cardiovascular system. For many patients, they are highly effective and extremely valuable medications. The challenge arises when timing is overlooked. Think about what a diuretic is designed to do. Its purpose is to encourage fluid elimination. If you take that medication late in the day, the increased urine production may occur precisely when you are trying to sleep. Suddenly, instead of enjoying uninterrupted rest, you are waking repeatedly throughout the night. Now consider what happens when an adult in their 70s or 80s rises quickly from bed at 2 o'clock in the morning. The room is dark. Blood pressure may shift upon standing. Balance may be less reliable than it once was. Vision may not adjust instantly. The risk of a fall increases dramatically. Falls are often discussed casually, but their consequences can be profound. A younger person may trip, feel embarrassed, and move on. An older adult may experience a completely different outcome. A single fall can result in fractures, hospitalization, loss of independence, prolonged rehabilitation, or complications that affect health for months or even years. One retired librarian shared a story that perfectly illustrates this issue. For more than a year, she woke 3 times every night. She believed poor sleep was simply part of growing older. She accepted exhaustion as her new normal. She stopped volunteering as frequently because she lacked energy. She became less active socially. Her world gradually became smaller. When her medication schedule was reviewed carefully, one detail stood out immediately. She had been taking her water pill with dinner every evening. Nobody had ever discussed timing. Nobody had explained that the medication's intended effect was occurring while she was trying to sleep. After moving the medication to the morning under medical guidance, the difference was remarkable. Within days, her nighttime bathroom trips decreased dramatically. Within weeks, her energy improved. Within months, she resumed activities she had abandoned. What is striking about stories like hers is how often people normalize preventable problems. They assume discomfort is inevitable. They stop asking questions. They stop searching for solutions. Yet sometimes the answer is hiding in plain sight. Have you ever accepted a symptom simply because you assumed aging caused it? Many people do. They stop mentioning it during appointments because they believe nothing can be done. But curiosity can be a powerful health tool. The simple act of asking, "Could there be another explanation?" sometimes uncovers opportunities for meaningful improvement. Sleep itself deserves more attention than it often receives. Quality sleep is not merely about feeling rested. During sleep, the body performs critical maintenance functions. Hormonal systems reset, memory consolidates, tissue repair occurs. The cardiovascular system benefits from restorative processes that support long-term health. When sleep becomes fragmented night after night, those benefits diminish. Fatigue accumulates, mood changes, concentration suffers, physical resilience declines. Over time, poor sleep can influence nearly every aspect of well-being. That is why medication timing should never be viewed as a minor detail. It is connected to the larger picture of healthy aging. Better timing may contribute to better sleep. Better sleep may contribute to better energy. Better energy may encourage more activity. More activity may support cardiovascular health. Everything is connected. There is another aspect of diuretic use that deserves discussion. Certain diuretics can affect electrolyte levels, including potassium. Potassium plays an important role in muscle function and heart rhythm regulation. Maintaining healthy levels is one reason healthcare providers often monitor laboratory results for patients taking these medications. This does not mean everyone should rush to buy supplements. In fact, supplements are not appropriate for everyone. The important takeaway is that medication management involves more than swallowing a pill. It involves understanding how that medication interacts with the body's broader systems. The older I become, the more convinced I am that successful aging is often about paying attention to seemingly small details. A daily walk, adequate hydration, consistent sleep, medication timing, balanced nutrition. Individually, each may seem modest. Collectively, they shape quality of life. That brings us to another mistake that almost everyone has made at least once. If you are honest with yourself, there is a good chance you have done it too. You forget your medication. Perhaps the day became unusually busy. Perhaps family visited. Perhaps you traveled. Perhaps your routine changed. Whatever the reason, hours pass before you suddenly remember. A wave of concern appears immediately. Did I take my pill? You retrace your steps mentally. You look at the pill bottle. You try to remember breakfast. The uncertainty grows. Then comes the temptation. Maybe I should just take 2. It sounds logical. 1 missed pill plus 1 scheduled pill equals 2 pills. Problem solved. At least that is what many people assume. Unfortunately, the body does not always interpret the situation so neatly. Medication schedules are carefully designed to create relatively stable drug levels within the bloodstream. Doubling a dose can sometimes create concentration levels much higher than intended. Depending on the medication involved, this may lead to dizziness, excessively low blood pressure, fainting, or other complications. A contractor in his mid-60s once developed a habit of compensating for missed doses by taking extra medication later in the day. He genuinely believed he was protecting himself. In his mind, he was correcting a mistake. Over time, however, that habit produced unpredictable swings in blood pressure. One evening, after taking additional medication to compensate for a missed morning dose, he became dizzy and lost consciousness briefly in his kitchen. Thankfully, he recovered without permanent injury. But the event highlighted a critical lesson. Good intentions do not always produce safe outcomes. The challenge is that every medication has unique instructions. What may be appropriate for one prescription may not be appropriate for another. That is why healthcare professionals emphasize following the specific guidance provided for your particular medication. Consistency remains one of the most powerful tools in blood pressure management. The goal is not perfection. Human beings forget things. That is normal. The goal is creating systems that make consistency easier. Some people place medications beside a toothbrush. Others use pill organizers. Some rely on smartphone reminders. Others link medication use to a daily habit, such as breakfast or evening reading. The specific method matters less than the consistency it creates. Behavioral scientists often refer to this as habit anchoring. Rather than relying solely on memory, you connect a desired behavior to an existing routine. Over time, the two become linked. The routine itself becomes the reminder. Think about how effortlessly you brush your teeth. Most people do not need an alarm. They do not need a checklist. The habit is embedded into daily life. Medication routines become more reliable when they achieve a similar level of automaticity. And yet, despite everything we have discussed so far, there remains one timing issue that continues generating debate among physicians, researchers, and patients alike. It is a topic that challenges decades of conventional thinking. It concerns the question many people have never even considered asking. Should blood pressure medication be taken at bedtime instead of in the morning? The answer is more nuanced than many headlines suggest, and understanding that nuance may be one of the most important conversations you have with your healthcare provider.